नहमदुहु व नसल्ली अला रसूलिहिल करीम अम्मा बाद फ़अऊज़ु बिल्लाहि मिनश शैतानिर रजीम बिस्मिल्लाहिर रहमानिर रहीम। Today's quote of the day is: the way to get started is to quit talking and begin doing. Assalamu alaikum everyone. Today's topic of discussion is McNamara's statistics. I am Dr. Fatma Jalal Chaudhary, MPhil PGR, and I'm going to present the same topic under the kind supervision of Professor Dr. Sara Afzal, who is Dean IPH Lahore. Now, what's the agenda for today's talk? Introduction to McNamara's test, different scenarios of the test, interpretation under different circumstances like SPSS analysis, chi-squared values, SPSS analysis, and other important interpretations related to the McNamara's test, chi-squared value and its interpretation, numerical problem solving and its implications, recent updates, MCQ session, and key takeaways. And at the end of the discussion forum, open. The objectives for today's presentation are: at the end of the presentation, the audience should be able to interpret basic definitions and implications of the McNamara test, its interpretations and different scenarios, interpretations through SPSS, implications, and discussion. Now, a brief introduction. What is McNamara's test? McNamara's test is a statistical test which is used to analyze the paired nominal data, specifically comparing two related samples on a dichotomous rate. It determines if there's a statistically significant difference between the proportions of an outcome before and after an intervention. Or it can also comply with the situation where two groups with the matched pairs are going to be under study. So, a brief history, the same test is being named after Quinn McNamara, who introduced it in 1947. An application of the test in genetics is the transmission disequilibrium test, which is used for detecting the linkage disequilibrium between the genes. So here's a brief explanation in which we are going to see what is McNamara test and what does it mean. So what it is, it's used in a paired data. It is designed for the data where the same subjects are measured twice or where subjects are measured in some way. For example, before and after treatment. Dichotomous variables should be there. The outcome being measured must have only two possible categories. For example, it could be a success or failure rate, yes or no, present or absent. So McNamara's test, where to use it? The commonly used parameters to assess a diagnostic test in medical sciences are, as everybody knows, sensitivity and specificity. So sensitivity or recall is the ability of a test to correctly identify the people with the disease. And specificity is the ability of the test to correctly identify those without the disease. Now presume that the two tests are performed on the same group of patients, and also presume that these tests have identical sensitivity and specificity, meaning both of the tests are going to detect correctly the people with the disease and without the disease. In this situation, one is carried away by these findings and presumes that both the tests are equal, and that means both are equally sensitive and specific. So how to know which test is more diagnostically correct? However, this may not be the case. And for this, we have to study the patients with the disease and patients without the disease by a reference test. We also have to find out where these two tests disagree with each other, exact point where the chi-squared value is to be found out, and specifically the sensitivity and specificity at that point is presumed. So this is precisely the basis of McNamara's test. This test compares the sensitivity and specificity of two diagnostic tests on the same group of patients. So this is another characteristic of the McNamara's test, which is the table. Basically, the data is typically organized in this test in a 2x2 contingency table with the 4 cells representing the combinations of the two outcome categories at the 2 points or between the two groups. So what does it do? It's testing for the marginal homogeneity. So, how are we going to test for the marginal homogeneity? The test checks if the marginal frequencies, the total counts for each outcome category are equal, which indicates no significant change or difference between the groups. So this is a more precise representation 2 by 2 contingency table which tabulates the outcomes of the two tests on a sample of n subjects. The null hypothesis of marginal homogeneity states that the two marginal probabilities for each outcome are the same, that is PA plus PB is equal to PA plus PC, and PC plus PD is equal to PB plus PD, like A, B, C, D. So test 2 positive, test 2 negative, test 1 positive, test 1 negative. The row total A plus B and C plus D, and in the column total we are going to concentrate on A plus C, B plus D, and N is the total number of the subjects or the sample size. So the null and alternate hypotheses are defined in this scenario. Our H naught should be PB is equal to PC, and alternate one PB is not equal to PC. Here, PA, etc. denote the theoretical probability of occurrences in cells with a corresponding label. So McNemar's test statistics in this case would be x square, which is the chi-squared value for B minus C whole square over B plus C. Under the null hypothesis, with a sufficiently large number of discordant cell B and C, x square has a chi-square distribution with 1 degree of freedom. If the x square result is significant, this provides sufficient evidence to reject the null hypothesis in favor of the alternative hypothesis. That means PB is not equal to PC. So which would mean that marginal proportions are significantly different from each other. When to use it before and after studies comparing the outcome of a treatment or intervention on the same individuals before and after the intervention. Matched pair studies comparing two related groups of subjects where the pairs are matched on certain characteristics, for example, twins or sub-siblings. Comparing different classifiers, evaluating the performance of two different classification algorithms on the same data set. So here to quote an example, imagine a study where researchers want to see if a new medication improves blood pressure in a group of patients. They measure the blood pressure of each patient before they start the medication and again after a period of time. The outcome could be either blood pressure within normal range after the start of the medication or blood pressure above the normal range. So McNemer test could be used to determine if there's a significant change in the proportion of patients with normal blood pressure after taking the medication. Now, McNemer's test using the SPSS statistics, SPSS analysis, for example, you could use the McNemer's test to determine whether the proportion of participants who had low self-esteem as opposed to high self-esteem before and after introduction of the treatment. So Laird statistics, McNemer and Mann-Whitney tests are used, and it's being stated in the StatPers and CBI bookshelf. McNemer, for more reference, McNemer's test. The McNemer's test is used to determine if there are differences on a dichotomous dependent variable between two related groups, and how are we going to present the data therein. So, in the first example, if we want to attempt to determine if a drug has an effect on a particular disease, there we are going to take a total number sample size for 314 patients, and they are diagnosed disease present or absent before and after using the drug. So this is the 2 by 2 contingency table. Here we can see present after the management, before the management, and before absent, and in this the particular disease is present. So, which means that each sample can be described using 1 out of 4 combinations, any of the 4 combinations. So, counts of individuals are given in the table with the diagnosis, disease present or absent before treatment given in the rows, and the diagnosis after the treatment in the columns. So, the test requires the same subjects to be included in the before and after measurements, which are the matched pairs. So, this is another example. Interpretation along the chi-squared value. In this example, the null hypothesis of marginal homogeneity would mean that there was no effect of the treatment. From the above data, the McNemus test statistics would be, which has a value of 21.35, which is extremely unlikely to form the distribution implied by the null hypothesis, in which P is less than 0.001. Does the test provide strong evidence to reject the null hypothesis of no treatment effect? That means alternate hypothesis would be applicable here. So discussion for this very particular example, an interesting observation when interpreting the McNemus test is that the elements of the main diagonal do not contribute to the decision about whether, like in the above example or previous example, pre or post-treatment condition is more favorable. Thus, the sum B plus C can either be small, and statistical power of the test described above can even be low. So the number of pairs A plus B plus C plus D is large as compared to B plus C, or even can be low. So an extension of McNemus test exists in situations where independence does not necessarily hold between the pairs, in which we are using a pair data. Instead, there are clusters of pair data where the pairs in a cluster may not be independent, but independence holds between different clusters. This is the case where the variables are basically dependent or independent, and they are in the form of a cluster. So information, slide information about the pairing, as we have discussed earlier, in the 1970s, it was conjectured that retaining one's tonsils might protect against Hodgkin's lymphoma. So this was the 2x2 contingency table formed: tonsillectomy, no tonsillectomy, Hodgkin's there, or Hodgkin's absent, control 33 and 52. John Rice wrote 85 Hodgkin's patients had a sibling of the same sex who was free of the disease. This was the writer who wrote that 85 patients total were there, and whose age was within 5 years of the patients. So these investigators presented the following table, as we have seen. So chi-squared statistic out of this table, it is that they calculated a chi-squared statistic. They had made an error in their analysis by ignoring the pairing. Like if there was a sibling population out of which one could have a tonsillectomy or don't and can suffer from Hodgkin's or not. So because the siblings were paired, so we set up a table that exhibits the pairing. So it is to the second table that McNemus test can be applied, in which siblings are mentioned. So notice that the sum of the second table is 85. The number of pairs of the siblings, whereas the sum of the numbers in the first table is twice as big as 170, the number of the total individuals. The second table gives more information than the first one. So chi-squared statistic applied on a paired sample size would be good. So what is the information we are going to get out of this example? The numbers in the first table can be found by using the numbers in the second table, but not the vice versa. So in which the pairing was done, that was a more reliable one. The numbers in the first table give only the marginal totals of the numbers in the second table. So McNemus test allows the 15 and 7 pairs where the siblings had previously differing treatment to their tonsils to be compared as being relevant to the hypothesis. That is, Hodgkin's disease would not occur in the patients who have a tonsillectomy, while ignoring the less informative 37 and 26, where the siblings had previously both had the treatment or to the tonsils who neither had the treatment. So this is time for our recent updates for the same topic. Paper 1, which we are going to discuss, was published in the Statistics in Medicine in September 2021. Weighted McNemus test for the comparison of two screening tests in the presence of verification bias. So the abstract says that statistical methods have been well developed for comparing two binary screening tests in the presence of verification bias. However, the complexity of existing methods and the computational difficulty in implementing them have restricted their use. A simple and easily implemented statistical method is therefore needed. So in this paper, we propose a weighted McNemus test statistic for comparing two sensitivities and specificities. The proposed test statistics are intuitive and simple to compute, only involving some minor modifications of a McNemus test statistic using the estimated verification probabilities for discordant pairs. Simulations demonstrate that the proposed weighted McNemus test statistics preserve type 1 error as well as or better than the existing statistics. So in the upcoming discussion, we'll see what is a type 1 error. So discussion, we have proposed new weighted McNemus statistics for testing equality of sensitivity and specificity of two screening tests in the presence of verification bias. So type 1 error equally well or better than your statistics based on the difference of the bias corrected sensitivities, specificities, or Alonso's statistics based on the ratio of the bias corrected sensitivities and specificities. The proposed statistics are intuitive and simple to compute, only involving some minor modifications of a McNemus test statistic using the estimated verification probabilities for discordant pairs. So at the end of the discussion, they would say McNemus statistics preserve type 1 error as well as the proposed weighted McNemus statistics in this special case. Thus, we recommend the weighted McNemus statistic for hypothesis testing over existing. So this is paper number 2, which is here for McNemus test using the SPSS statistic, where we'll be taking the assumptions under consideration. The McNemus test is used to determine if there are differences on a dichotomous dependent variable between two related groups. It can be considered to be similar to the paired sample t-test, but for a dichotomous rather than a continuous dependent variable. So what are the assumptions for the McNemus test in the SPSS analysis? You can learn more about the dichotomous variables in our article. Types of variables having an independent variable with two related groups indicates that you have a pre-test, post-test match pairs or case control study design. Assumption number 2, the two groups of your dependent variable must be mutually exclusive. Assumption number 3, the cases, for example, participants are a random sample from the population of interest. However, in practice, this is not always how sampling took place. So if your study design does not meet these three assumptions, you cannot use a McNemus test, but you may be able to use another statistical test instead. For this test, statistical test selector could be used. However, assuming that you are using the correct test based on the result above, we could report the results of the study as follows. 50% participants were recruited. This is just an example. Were recruited to take part in an intervention designed to warn about the dangers of smoking. An exact McNemus test determined that there was a statistically significant difference in the proportion of non-smokers pre and post intervention with a p-value at 0.027. So this is how we are going to interpret and report the McNemus. So this is the time for the MCQs and our key takeaways. MCQ number 1 is a researcher tests whether a new app improves study habits among the students. App is gadget sort of thing. So students report whether they studied regularly or irregularly before and after using the app. So the question here is based on this scenario, what is the most appropriate test to determine whether the app changes the study habit? Number A is pair t-test, chi-square t-test, chi-square test for independence, McNemus, Wilcoxon signed rank, or unpaired t-test. C. Yes, it is C, McNemus test, because basically, as you can see, that it is before and after the intervention, which is the introduction of the app. So MCQ number 2, a medical team records whether the patients tested positive or negative on a disease test using two different diagnostic methods on the same group. The question here is, what assumption justifies the use of the McNemus test in this scenario, in which the medical team has a patient who are testing either positive or negative on a disease. So data are independent across the groups. The observations are continuous. The responses are merit and binary. There is a large difference in the sample sizes. The data is not normally distributed. McNemus test. So, okay, the data are independent across the groups, as we have discussed in the previous slides, that matched pairs having a binary bias are the best sort of data which are to be selected for a McNemus test to be applied to know the specificity and sensitivity of the test. So the correct answer is C. For MCQ number 3, in a smoking cessation program, 100 participants are recorded as smokers or non-smokers before and after 3 months of counseling. So which table configuration does McNemus test analyze? 2x2 table with independent samples, 2x2 table focusing on concordant cells, 2x2 table focusing on discordant cells, or 3x3 table of all response categories, 2x1 table with the matching.
B.
Okay.
B.
No, it's 2x2 table focusing on discordant cells. As we have discussed in the previous slides, no concordant data with discordant data.
Answer is A.
The answer is C. So MCQ number 4, a school checks if a reading program changes students' reading performance from below grade level to at or above the grade level. So question here arises, if 40 students improved, 10 declined and 5 stayed the same, what is used in McNemus test statistic? Only the 40 who improved, all 100 students, the 40 who improved and 10 who declined, only those who stayed the same, those who didn't participate in the study at all. Which were the basic study population? Okay, select the 40 who improved and 10 who declined. Because below the grade level, at or above the grade level, so under consideration 40 who improved before the introduction of the reading program and 10 who declined not to participate at all, which are to be excluded from the. So MCQ number 5, an app measures whether users preferred a new interface over the old one. 80 users were surveyed twice. McNemus test is best suited for this scenario. If preferences are recorded as Likert scales, users are categorized as prefer old or prefer new. Users rate satisfaction on a scale from 1 to 10. Groups of users are independent. Groups of users are unfit for participation. Which scenario? Here, as we know that in the McNemus test, we have to categorize as something before or after intervention. So scales or independent or these match pairs with the bias are preferred here. So B is the correct answer. So MCQ number 6. You apply McNemus test to evaluate if there's a change in yes or no response before and after training. So which null hypothesis does McNemus test evaluate? The population proportions are equal across groups. The marginal probabilities are not equal. The probability of discordant pairs is equal. There is no correlation between time and response. There is no proportion between any of the variables.
B.
C. Okay, again, the C's answer, the probability of discordant pairs is equal. They are to be considered always in a probability sequence where we are going to use a McNemus test to be applied. Pairs with a bias, discordant probabilities. So MCQ number 7, in a study with 200 people, a new diet is assessed. 30 switched from unhealthy to healthy and 50 switched the opposite way, that is from healthy to unhealthy. What is the McNemus test statistic without continuity correction? 30 plus 50 to 30 minus 5, fraction of 30 plus 50 into 2 and 30 minus 50, as we have discussed in the previous slides for the formula applied chi-squared value to be found out. So I guess this one would be a difficult scenario. So B is the correct answer in which we are going to study the, yeah, B is the correct answer. Out of the 200, how are we going to calculate the population size and other things? So MCQ number 8. You observe before and after support for a new policy support versus do not support. There are more changes from support to do not support than the reverse. So what test what result would McNemus test likely produce? A p-value indicating independence, a high chi-square value with p less than 0.05, a test for multiple group comparisons, a t-statistic for difference in means, or an ANOVA test. C. Okay,
C.
yes. We can basically compare between two things here. Either it could be B or C. Multiple groups are there, and a high chi-square value with P less than 0.05 is the most appropriate situation for this McNemus test here. So going on to our next MCQ, a company wants to test if a new onboarding video increases employee satisfaction, satisfied versus not satisfied. Which situation would invalidate the use of McNemus test? That means can't be used here in the scenarios. Enlisted data collected before and after watching the video. Responses are categorized as satisfied or non-satisfied. Observations are paired for each employee. Groups of employees are independently selected for pre and post test. All responses are paired and matched. I guess this could be applied data collected before and after. Responses are categorized. This could be applied for McNemus. Observations are paired. This also could be applied. So groups of employees are independently selected for pre and post test. This can't be under consideration here. And responses are paired and matched. So it could also be very well be coming here. So answer would be D. MCQ number 10, a McNemus test shows a p-value of 0.001 in a matched pair study comparing diagnosis outcomes. How should this result be interpreted? There is no difference in the diagnosis outcomes. The change is not statistically significant. There is strong evidence of a difference in outcomes, and sample size is too small to conclude anything, or P and T values do not match at all. B value, yeah. B is the chain is not statistically significant. This could be the scenario, but as the p value is very less, it's 0.001. So there is strong evidence of a difference in outcome. Matched pair study in which the McNemus diagnosis test comes out where the p value is very less, we can safely say, and there is a strong evidence for the differences in outcome. So null hypothesis is to be rejected and alternative to be accepted. So this is the key to our MCQs, and this is our YouTube link where all of the informational and educational content would be uploaded. Please do like and watch the videos as per your time consumption so that we can also be facilitated. And thank you very much for listening to me and bearing with me.